I am Martin Deleuze. I've been teaching yoga for over 20 years now, and the vast majority of that has been in Kailua. I used to own Aloha Yoga Kula Studios for 13 years in Kailua. And now I'm teaching, which this is now my home. And a lot of people know Vela, the yoga dog, who is right here. She's also 13 years old, so I guess I got her right about the same time I started the yoga studio. And yeah, I feel very fortunate that I've gotten to work in and around with a lot of the professional health community in Hawaii, especially on Oahu, and at different times for different reasons, been invited either to John Burns or Queens or Castle to either work with specific patients or to educate the staff on how yoga can be helpful as a healing part of your journey outside of just the medical system. That generally is what people ask me about. Like, well, how do we use a yoga studio? How do we use yoga to continue outside of what a doctor can do for you or what a doctor can prescribe? Unfortunately, most yoga studios and sessions are not they're not paid for by insurances these days. So unless you can get like a gym membership sometimes with your insurance, and that might include some gym yoga classes. So most times what my experience is in these situations is, and just because probably most of you logging on are in the Western medical field, that many of your patients are going to ask, well, is this like an insurance thing? Can I get it paid for? Me and most of my compatriots are outside of the system, which is really great in some levels and also difficult for some people to wrap their heads around. The cool thing is I can pretty much kind of, step in wherever someone needs me. I don't have any conflict of interest. I think Western medicine is fantastic, especially at saving lives. But I think that there's a lot of things that in Western medicine, we just don't have the ability to take the time and, or are trained on the know-hows to do certain things. So that being said, that's where I'm coming from. I've been doing this for a long time, and I love interacting with this group of people. That being said, as I was telling Shar, I got asked to talk about chronic pain, and I said, boy, that's kind of like asking me to talk about sandwiches. There's a lot of sandwiches out there. There's a lot of different kind of sandwiches. There's a lot, chronic pain. I loved all your definitions. It gives me a better idea of where you guys are coming from with that. And I just thought I thought the Google responses were very interesting because I know you're probably in a very similar situation, as am I now. People, if their doctor tells them they have something, they go home, they Google it, and if for somehow they landed in my lap, I get both what they think their doctor said. That's a favorite one. What they think their doctor said, along with the Google definition. So chronic pain, according to Google, we got a couple quick answers here. I thought this one was really good because what I didn't hear in your responses was part of this one. The pain may be caused by inflammation or dysfunctional nerves. That dysfunctional nerves part was a little hard for me to swallow, but there we go. Okay, that's first part of what Google says here. And the next one was, how do you define chronic pain? It says chronic pain is long-standing pain that persists beyond the usual recovery period or occurs along with a chronic health condition such as arthritis. that that's cool. This is kind of, we heard a lot of that, like goes beyond what is like easily treatable, or like, oh, I slept on my neck wrong, went to the chiropractor or whatever, and 2 days later it feels fine. So chronic pain would go beyond that, right? I did think it was interesting that they said arthritis, because arthritis is an inflammatory disease. Okay. So that was interesting to me. And then common types of chronic pain include arthritis and joint pain, okay, back pain, neck pain, cancer pain near a tumor. Google's interesting. I don't know about that one. I mean, we want to address that for sure. But, chronic pain, headaches, including migraines. That was, because when I first thought about chronic pain as well in my practice, migraines come up a lot, and yet I don't see migraine patients all the time acknowledge themselves as chronic pain patients, or I don't know how the doctors look at it. So I thought that was kind of cool and interesting and good. Next one, I mean, this shows up. These are bullet points, like when you Google this. Testicular pain. And the next was lasting pain in scar tissue. And then the next was muscle pain all over, such as fibromyalgia. Well, the beard might fool you, but I'm a feminist at heart. I think that it's interesting that testicular pain made the list, but this is only acknowledging a male situation. So we'll take that with a grain of salt. But I did think that it was interesting that they mentioned fibromyalgia, because like arthritis, this is also an inflammatory response. So, interesting. Like, what's our definition of chronic pain? How broad is that definition, and how many people just kind of walk in and are like, hey, this is what I got and it's not going away. So when I was making some notes on like, my own idea, my kind of bullet points started with like what might be the cause. My top one is inflammation. The next would be physical, but usually meaning like movement or a pattern or a specific injury, which then we're going to go back to inflammation. So the definition that I understand is like, without inflammation, there's no pain. So inflammation is a real like pain identifier. And boy, as you guys know, pain is hard to treat. That's like the big thing, is how each individual interprets pain, all of that. Pain is so hard to treat. So I think chronic pain is like very difficult to treat. And I have a lot of compassion for you guys being on the receiving end of that, because people that seek out a doctor are like really wanting a solution. And that's a hard thing to be put in, because you first have to get a diagnosis, and then we have to start treatment. So my ideas were inflammation, physical, the aspects that I can deal with the physical, I can feel with the endocrine system. Ayurveda, which is a part of yoga, it's kind of the yoga medicine. And a lot of that has to do with like, we usually start with dietary and body practice in Ayurveda. So that would also be like the physical movement, along with like, hey, let's talk about what you're eating and how good do you feel when you eat those certain things. And then there's breathing and meditation, which is classically what people like to talk about in the yoga realm as the mind-body connection. I don't really like that definition so much, because I don't feel like there's much of a difference between the mind and the body. If you're talking about brain function, and body function and how that equals the mind. That's kind of more where I see it. And then of course in there, the mind is also includes the emotional body. So it's like, how does the brain and the body, how are these things working together to create how you feel, right? And that's, to me, where the mind is about how you feel. But that being all said, okay, so we kind of went around and said, like, where's chronic pain? And if we're going to talk now about how I can interact with your patients or you about it, I would say the number one thing that happens is that we can start to deal with the way we're thinking and the way we're focusing. And from there, then we go into movement. So I'm just going to try and focus now in a little bit more on those two aspects. So mind, body, for lack of better terms, or brain body connection to equal our emotional body, our mind, along with how we move, because how we move changes the way we think and feel. That being said, if someone has a chronic knee pain, outside of mind body, can I deal with how they're moving to help their chronic knee pain, i.e. arthritis, inflammation, some sort of structural movement or an injury that happened? Yes, I can. So yoga has a lot of angles that it can approach things. It's certainly not a cure-all, but it just depends on how the patient really wants to approach the yoga practice, whether or not that's going to be helpful to them. So with somebody like migraines, how about like anxiety or a chronic inflammation that is creating anxiety, like, oh, I hurt all the time, and they're focused on, that's an issue that's going to be a chronic pain issue. The way yoga approaches that is first by focusing our body, our brains, and trying to connect those two things together to help create that mind quality. So let's do a little practice, just a little relaxation practice that would actually be generally how I kind of start my classes, one. But two, if I were dealing with somebody that was sitting in front of me with, say, like fibromyalgia, I would probably take them through this exact same thing to help get them more connected to their body and their breath without having them just be in competition with the pain that they're experiencing. So wherever you are, if you're sitting in a chair, try and sit up tall, rock your pelvis forward. That's to roll that lower back in, sit at the fronts of the sits bones, squeeze your abs in, lift your chest up. The hands can either be sitting on tops of the thighs or on the fronts of your knees. I like the knees sometimes because I can pull my pelvis forward and sit up a little bit taller. You can let the chin come down, float the ears back, and then maybe you can let your eyes close. And as you take a deep breath, nice, smooth, even exhalation. As you bring your whole attention to your breath and the action of breathing. In our practice of yoga, we use the breath as that point of awareness that brings the energy of our minds to this moment. We're letting go of the constant movement of the mind. The mind that likes to run from past experience, analyze our past experiences, and then project into the future with expectations, desires, outcomes. And instead, we come back to this breath, this inhalation, this exhalation. And it's from this constant concentration on the breath and breathing that we also get a deeper awareness of the body. So now, as you feel the breath moving through the body, this sensation, this awareness becomes the information we need to create present action. Once you can feel the muscles move with the breath, then you can choose to engage the muscles, to align the bones, to bring presence into your posture, your pose, your asana. So here, as you root down through the sits bones, letting the spine grow up tall out of your seat. On the exhale, drawing the lower belly in and up, moving the energy and air upward and outward. The inhalation has two directions. We root down into our seat as we exhale and rise and lengthen. The inhale, rooting and lengthening at the same time. The exhale continues that rising quality, energy and air all the way up through to the third eye and the crown of the head. Inhale, root and rise. Exhale, keep rising. Inhale, root and rise. Exhale, keep rising. And we'll take just a few moments here to allow one of our other elements of yoga practice that we can use in Ayurveda as sound and vibration that are also healing. You may have heard of sound baths or sound meditation. This will last approximately 2.5 minutes. Come back to the body, come back to the breath. Namaste. So you can let your eyes open. As you do, we can kind of check in with our own bodies and notice how we're feeling. You know, maybe some people were agitated by having to take 2 to 3 minutes out of their day to sit and be quiet, but you know, maybe learning to do that will be healthy for you, especially if you have something nagging like chronic pain. So, you know, somebody who has a migraine, that could be really helpful. Fibromyalgia, that could be really helpful. That's going to be, you know, the kind of thing that's a body pain that's not going away. But one of the things that I thought was really interesting, that very first Google definition said, the pain may be caused by inflammation or dysfunctional nerves. Well, dysfunctional nerves, that's kind of a strange category, because if you're talking about fibromyalgia, then it would be like inflammation in the nerves. So is that the same as dysfunctional nerves? Or are we talking about some other pains that happen because of muscles, maybe pressing on nerves, or muscles that are dysfunctional themselves because of movement and are creating some sort of chronic pain, i.e. maybe some joint pain? So I thought that one was kind of an interesting category, especially for yoga, because yoga works a lot of the time, especially if you got, you know, patients that can have access to gym yoga. This is going to be about movement, right? So movement and that centering that we just did can work together so that you're focusing on your body while you move. But sometimes people can't even get there. They have a hard time really including the mastery or working on the mastery of the mind. So in that way, what yoga can still offer, even if a person can't get to the mastery of the mind situation, then we can still offer healthy movement. And healthy movement can be really good for a lot of chronic pain. One of my favorites to talk about is going to be the lower back pain, i.e. or sciatic pain. And because what we have often in our society is the sitting thing, right? And so you just saw me, I rolled back on the backs of my sits bones and I'm slouching in my seat. I could be on my computer right now. I could be on my cell phone. I could be in a meeting. And a lot of people who have jobs that include them to sit down and be intellectual have a lot of chronic body pain. And much of that can, you know, be from slouching shoulders, craning the neck, all that sort of stuff. But it is my experience that a lot of that starts and has to do with the hips. So let's just talk a little bit about what happens in the hips to cause some of this pain, just as like a kind of percentage-wise high example of physical chronic pain and how I might approach it as a yoga teacher. I could distill it down to kind of like one muscle and or a grouping of muscles, and that being the outer glutes, and or as it works in from the outer glutes into hamstrings, or maybe the experiences in the lower back because of tight glutes or tight hamstrings. So the muscles, like why would they say nerve pain on Google? Or how could that definition apply to what I'm talking about? Is that you could have the gluteus medius pressing down on the nerves that run down the leg, or you can have piriformis and gemellus kind of clamping down on that sciatic nerve. Now, to stretch piriformis and try and create some space to get that release on that sciatic nerve or any nerve grouping in that area, there's a lot of different ways to handle that yoga posture wise. But the basic thing that we're going to want to do is create hip flexion with spinal extension, 1, and then 2, try and lengthen those muscles even more. So is it a nerve dysfunction or is it a muscular dysfunction? With movement, I can deal with the muscular dysfunction, which may hopefully provide some nerve relief. So let's look at like one of a few favorite postures, or a couple of favorite postures that might help to do something like that. So I happen to know that Kelly shared with her husband, Sean, who is also an MD, that he was having lower back pain. She showed him this one posture, and I'm just going to move my Chihuahua Terrier out of the way. There we go. And she showed him this one posture, and he started doing this one posture, and his lower back pain went away almost immediately. So let's look at what is classically called a pigeon pose. And so this would be a way to work with the nerves in the leg, i.e. the hips, in the form of yoga. So I'm going to come onto my mat here, and you can try this with me if you like. I'll walk you through it, or you can just observe. But you'll start to see how I'm going to take these muscles that go across the back of the hip, they're called glutes, and I'm going to start to put them in a position where not only do I get to flex my hip, but I also get to stretch those muscles in the back of the hip. So I'm going to step my right foot forward, and then I'm going to heel toe my right foot across the mat. As I do, I let the knee come forward and down. A lot of people try and just let the knee go out to the side. That's going to twist the knee. That's never a good situation. The knee can come forward and down to just hinge in the knee, which the knee likes. Then I can back my left knee up a little bit, and already I can feel a stretch through the back of this right hip. From here, I lift the chest. It's good to feel spinal extension out of this deep hip flexion. That's what I would call an athletic alignment. And just going here, I know already is going to help my hips and my legs feel better. Because believe it or not, even though I'm a yoga teacher and I do this all the time, I still get a lot of hip and leg pain. In fact, if I'm not careful and I don't do the stretches that I need to do just for myself, I have plantar fasciitis in my left foot. I have since I was 21. So, there's things that I deal with as well. So you can have this variation. This is called a pigeon pose, but this is also called a pigeon pose when you hinge forward and lean forward over that front leg. I see this one taught a lot in gym classes because this is what I would call more of a restorative posture where you're just kind of able to relax and be down. But for most people, they feel a lot of intensity through the outer hip because all of this stuff is stretching back here. And this would be a pigeon pose. So this would be very helpful for lower back and sciatic pain, which is probably a big part of what people will complain about, saying, as chronic pain that doesn't go away. And certainly, hopefully, not something that deserves surgical intervention. That being said, you can see this shape here. I'm going to grab a chair real quick and show you how this can also look in a chair position. So if people are in an office or they're not able to get down to the floor because of a certain type of injury or age, then you might be able to do it in a different way. Before I grab the chair though, for those of you that might be trying this with me, you can switch sides just by walking your hands back, slide that foot back. Maybe you do something really classic, like a downward facing dog here, where you lift your hips up and you draw your hips up and back to stretch the legs. This also opens up the shoulders and chest, getting some range of motion in the shoulders. And then you could bring the knees back down. We could do the other side. The left foot steps forward, the left foot goes across the mat. The knee comes forward and down, and then we walk that right knee back to stretch those left glutes. You could stay here, definitely take a few breaths up here, and then maybe hinging forward. Okay, so you guys can play with that a little bit. I'm going to grab my chair real quick and show you how we can also take this kind of situation into what we like to do as an office style yoga, or like I said, if we have people who can't get onto the floor. So with my chair here, I can get a lot of the similar kind of opening in my glutes simply by taking and making sure that I've got a nice base here, and I'll call this my right leg. And because the left butt tends to be the one to get a little bit tighter because we use our left side to stabilize, let's take that left ankle and we'll just cross it over that right knee. Now, if you're like this, fair enough. Hold on to the front of that shin, rock the pelvis forward, sit up tall. If you can, let that left knee start to drop down, and we have this nice pigeon pose style shape here. The way to get more stretch really is to rock the pelvis forward. So that pulls the lower back in, we sit up tall, and I can do that just by holding on to the front of the ankle and knee as I try and stretch that right hip. So those are a couple of good examples of physical positions in the yoga practice that can be used to deal with chronic pain. Now, a lot of times, just to be, all encompassing, we get a lot of chronic neck and shoulder pain. It is my experience through working with the physical body, if the person needs some alignment, that I have to do hip stuff first. But that being said, we can also work with shoulders, head, and neck in many different ways as well. So I'm just going to bring my left foot back down. And if you were working left and right and you want to try both out, go ahead and do the right side. But I'm just going to sit forward here and sit up nice and tall, and then also educate myself and my student about how to move the head and neck properly. I see oftentimes people will come into a yoga class and we start talking about neck movement, and they'll do this thing all the way around in circles. And I'm like, oh my God, that just looks really painful to me. So it's my understanding that as you move to the sides, there's a little bit of place here where if you try and go all the way around, you're pinching the nerves in the neck. So we get back to that nerve pinch situation that Google liked to give us. And if I was dealing with a neck pain situation, which may come from the shoulder, may come from tight upper back muscles, definitely from lack of hip alignment, that I might like to educate my friends on how to move the chin down but keep the chest up, and then just roll the head a little side to side. So I inhale, I move one ear over the shoulder, and then I exhale, bring the chin to the chest, and I inhale and I move the opposite ear to shoulder, and I exhale and I bring the chin to the chest. And I love this one because this opens up some of those really kind of strange muscles that don't get talked about a lot, like the sternocleidomastoid, but also some big muscles that give like neck and shoulder pain, like the trapezius muscles. And then if I want to work the opposite direction a bit more, I let the chin come down to the chest, I lift the head all the way up, and then through center I let the head fall back, and then I can roll the head just side to side as the head falls back. And it's a much smaller range of motion, but boy, it feels really good. You can definitely tell where there's some places that feel like the muscles are pinching on nerves. And maybe where I haven't gotten my neck to move, unless I were to sit here and do this specifically, but it's a much smaller range of motion than the forward one. Let's do just another breath or two, kind of side to side through the back. And then as you let the head come back to center, you can lift the head all the way back up through center and take a breath. To work this down the arm, simply take that right arm out to the side, reaching out through the right palm. I can take the left hand over to the right side of the head, and I'm just letting the weight of my left arm open up that right side of the neck. I'm not pulling, I'm just letting gravity do its job here. And then you can let the hand come back over to that left side of the head and press the head back up to center. Maybe we can take an inhale to reach the arms up, and then we can switch sides. Right hand to left side of the head, left hand out to the side. Inhale and exhale. Let that right ear move towards the right shoulder. So the most common place for us to access yoga in our society and our culture is through the physical practice of yoga. If someone has the opportunity to take one-on-one sessions with a yoga teacher who is well educated and knows a bit about Ayurveda, we could also talk about inflammation. We could talk about diet. We could talk about stress. The word mindfulness and handling stress, because stress also causes inflammatory responses. So we can work with the inflammation, but we can also, and what we're probably most familiar with in yoga practice is how to deal with muscles maybe pushing on nerves and alignment. That's probably the most common way that people think of yoga as working with chronic pain. But like I said, yoga can work with chronic pain from also the mindfulness aspect, meditation, breathing, centering, and depending on the student and the teacher, maybe also having some Ayurvedic ways of looking at diet as well. That being said, I understand that I was to leave a little bit of time for questions. So I think that we've kind of gone over our definition of chronic pain, how yoga tends to interact with that for the most part, and I will open it up to questions.
Thank you so much, Martin. That was awesome. We have, I think Dan is on here. If you had any questions, specifically Dan's for today.
Martin, thank you so much. It's amazing what you've done in a short amount of time for us. I think we're all looking for resources to share with the patients that we work with. And then what would you recommend to the group on how to help those that they work with try to find a teacher or a program that they could start, irregardless of kind of where they are in their development or mastery of yoga?
Truly. Well, I think that we the first thing to do might be to assess what the yoga student or what the patient needs, i.e. like, do they need a concentration on mindfulness, meditation, a person with anxiety, with fibromyalgia, like going through of an intense physical practice may not really be super helpful. So helping them and looking into the community to find those sorts of resources. Unfortunately, here we are, post-pandemic, yoga studios have shut down all over the place. There's kind of a free-for-all of yoga teachers right now, doing kind of what I guess we would call pop-up events, these days, and a few yoga studios that are open. But I would look for things like I mentioned, sound bath. That's with crystal bowls, and so the sounds that we did in the beginning, that's dear friend of mine created a whole product where he did his Tibetan bowls. He tuned them to what is called the love frequency, and that's a little bit lower than 440. I think it's 436.8 or something like that. And it's supposed to work wonders for your mind and body in that way. And then there's the other person who's like, talking about like sciatic pain or something like that. That person needs a physical practice. They need to do the positions like we were looking at before, right? So I would first just kind of try and suggest to that patient like which way they need to go. Mindfulness practice, physical practice, all of it ends up being the mind, because the body and the brain work together, right? But I would kind of look at it that way. Just FYI too, for some people who have wartime PTSD, oftentimes sound baths are not their favorite thing, because the intensity of the sound swirling sounds like a gunfight to them. And it can be really upsetting to somebody that has like explosion or gunfire trauma.
Thank you.
Thank you.
We got a few comments. So Renata shared, I like the term emotional body. Jamie Starling, she said, I don't have chronic pain, but currently transitioning from breastfeeding to formula, and the engorgement pain has been awful. Yoga actually does help with the inflammation and swelling, like you said. Maybe just a state of mind to help my body through these changes.
Yeah, absolutely. Actually, so funny. I had a girlfriend over here just last night that was, she's traveling, and she came to do, she instructs for speech therapy, doing the scoping and through the nose. So she's a medical professional herself. And she was sitting there like going this way. I'm like making food for the whole group. And I said, oh, is your shoulder okay? And she goes, oh no, it's just, I left my 1-year-old at home and I'm stopping breastfeeding. So it's funny that you mentioned that. I think with stuff like that, it's really important to remember that everybody goes through that, and that like self-massage is so great. Like, I think a big part of what happens for our culture is, and I think that what I love about yoga is it takes a lot of some people get really angry with yoga for not being part of the Western culture. Like, oh, all of a sudden it's a religious thing. It's not. It's not religion at all. There's no religious aspect to it. It's the spiritual component comes from you looking at yourself. But that opportunity to get on the mat, to do those movements, to touch yourself, to feel yourself, to be close to yourself, that to me is that whole part of the completion of the brain body connection that equals the mind, the emotional body, right? We have ways of cultivating feelings, and certainly with ending a breastfeeding and transitioning to formula, there's like all this physical pain that goes along with all the emotional pain of transitioning with the child as a mother, as a parent, into these new realms. So thank you.
Awesome. Layla said that she liked the stretch that you did. It's one of her favorites. Arlena shared, glad to hear diet is included, especially if inflammation is caused by what is eaten.
Yeah.
Kyla said Adrian by Yoga on YouTube is great. And a couple people have heard of her too. She also recommended there's a lot of YouTube that has meditation sounds and music. Would you think that's a good option too? Like, what's your take, I guess, on having access to resources online?
Yeah, the reason I guess I don't mention it is because there's just so much. Like
Well, they
there's
name
so
one
much
girl.
out there. You know, I can't really speak for too many of them because I don't use those necessarily
Hmm.
myself, but there's a lot out there. And if you as a health provider go find ones that you like, then I think that that's the best thing. By the way, I work with Kelly on talking to the freshmen at at John Burns once a
Hmm.
year, and the big message with that one is you got to get out in your community and find out what resources are available. And of course, online community is part of that these days. So, if you find certain things on the web that you like, great. I can also say that for post pandemic, just this is how I teach yoga classes. I have people that I think before you guys all got online, Shar and I were talking, and so in my yoga studio out there is where the yoga students come and show up, and I allow 10 people to come to my yoga studio now. I have about 700 square feet, and then the camera's here, and this is what people see on Zoom. So if you want to come to Zoom classes, I know you guys have my information, they can give it to you. Zoom classes are offered 5 times a week. I have athletic ones, and then I have ones that are a little more what I call slow-mo classes, which are great for people with injuries, post-op stuff like that, aged, balance problems. Slow-mo is good for them. People who maybe were athletic, going through did their PT and rehab, but they really want to get up to like the next level. They want to get back to running, they want to get back to handstands or whatever. Then the flow-mo classes are a little bit better for them, a little more athletic. So I provide online resources as well. I think that that's going to be kind of the future for yoga. It's
Okay. What's your
yeah.
do you have a website?
Yeah, I don't right now.
Okay.
I shut all that down at the beginning of the pandemic. I think you guys can understand. I didn't want to be, as things were going up and down and up and down, I didn't want to be the guy that was like, hey, come do yoga. And then all of a sudden, like 3 weeks later, I'm an asshole because I like invited a bunch of people to give each other COVID. So I've had to kind of like, the keep the pod small. I mean, we're kind of at a place, so if one of you was interested in coming, or you have a specific person, what's nice here is you can all get in touch with me very easily. Kelly and Shar have my information.
Okay. We'll
And
do it that
anybody can
way.
do,
If anyone
yeah,
wants to make contact with you, we will be the middleman.
yeah. And the Zoom, you can give the Zoom link out to your patients. I really am just super open to people coming to that, showing up whenever. I do have like people just for payment, people just, send me money via Venmo or PayPal. And to be honest, when it comes to the Zoom situation, money is my last concern. I could have, I don't know what their top is, like 200 people on Zoom. And if you had patients that need that, like, get them on there. If they want to send me $5 a month, that's great. If they don't have anything, that's great. If they can pay full price for classes, then they're helping other people maintain this resource, and it's here for the community.
Oh, that's wonderful. Okay, I'll send you an email afterward to get that Zoom link to share with our group. Are there
Yeah.
any other last minute questions? We see Renata here. She said, I remember something about cabbage leaves to help ease with breast pain for our other moms that are on here. And then Arlena said, I keep something playing in the background throughout the day while I work. So it helps me keep my anxiety and stress levels low. So I think that kind of ties in with the sounds. because
Yeah.
I kind of do the same thing.
Yeah. Yeah, you know, it's funny, these little things, this just happens to be the product I'm using. They're called Nows, and like I said, a friend of mine produced these. And I, at one point, this is a couple of years ago, I brought in a whole bunch of these, and I had 3 different midwives buy these so that they could take them into the hospital with them and put them on women's bellies,
Oh
because
wow.
they came back. All of them came back and were like, you know, the vibration is just so powerful. So I know these made their way into the hospitals. I know one of them works at Castle. Won't name any names, and the other two worked at one was at. They're either both at Capulani or one was Queens and Capulani. But either way, you know, those midwives. They're a little witchy.
All right. Well, thank you so much for today. It was a great switch up, and even doing the demonstrations. I already got some emails of people requesting to have you back.